Dr. Gupta, I'm going to start with you. Our viewers put science at the center, but for the stray cats from other political stripes who might be listening, talk about the safety of the vaccine.
Good afternoon, Nicole. Well, you know, we've talked about this before, but for all your viewers out there and for all of those who are concerned about this issue, one of the comments I get is, well, how could it be safe if it was developed in 10 months? And the truth here is no other vaccine effort development in history has had every leading scientist, every government, every nonprofit, every private sector company focused on one specific end goal. And what we know above all else is that this vaccine is very safe. It's been tested on tens of thousands of individuals before it went into the arms of tens of millions of individuals. And what we also know is that the incidence of any severe adverse event that's highly manageable is 1 in a million. So, Nicole, safety is not an issue. What I will say is I was alarmed by two things you set up in the introduction. Number one is this notion of natural immunity that Senator Johnson is referencing. We know that that's not a thing to hang your hat on. So every viewer out there, natural immunity may not protect you for more than a few months. And especially given this emergence of these new variants, it appears, especially with the variant first identified in South Africa, that you can get reinfected quite easily if you have the old version of the virus, than say even 30 days. So don't hang your hat on it. Once your symptoms resolve, if you've had or currently have the infection, get the vaccine. Don't listen to Senator Johnson. Number two, to that young representative, the 25-year-old representative who's saying the survival rate's quite high. Yes, it is. But I've also personally cared for individuals that are 18 years of age who've ended up in the intensive care unit, completely unpredictable, otherwise healthy, now on life support. So this can affect us all, whether you're 18 or 80. You can't think you're invincible here. And finally, I'll say the quickest way to normalcy, to plan that summer vacation, is if we all get this vaccine, not just some of us.
Well, I want to press you on that, Dr. Gupta, because if you look at countries where they're farther along in vaccinating their publics, the most sort of comforting statistic is that the Pfizer vaccine cut symptomatic transmission 97% and asymptomatic spread 94%. It seems that until we have the spread and the transmission shut down, we haven't done all of the public health good that the vaccine promises.
You're exactly right, Nicole, if I may. I think your team has a chart that I'd like to reference here, but it's that chart here. Forecast a few scenarios. Do you want to draw viewers' attention to that pink line at top? Nicole, that's what happens if we don't have wide adoption of the vaccine, which, to your point, reduces symptomatic transmission and also just keeps people out of the hospital. We could still very well see this pandemic rage to the tune of 1,000 deaths and 100,000 infections a day well into July, when we're planning, according to President Biden, our July 4th vacations. It may not be that way. And that's if we don't have wide adoption quickly. So that means everybody, regardless of your age. Number two, that also supposes that worse outcome, that supposes more governors fall by the way of Governor Abbott and start loosening mask mandates and other common sense initiatives too soon, to allow then the variants to continue to evolve and potentially change even more. That worst outcome should be top of mind for everybody here. We're not through the worst of this. It could get worse. We could not be past this by the summer if we let these things continue to go unrestrained.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.